But I want to get started with some folks, and I want to introduce to you Ari Armstrong, who has published freecolorado.com since 1998, since before the term blog was coined. He's a recipient of the 2009 Modern Day Sam Adams Award. Armstrong has written numerous articles about health policy for the Grand Junction Free Press with his father Lynn, the Independence Institute, and his webpage. Ari and his wife Jennifer were also featured in the July issue of Money Magazine in a piece on health savings accounts. Ari?
Thank you so much, and I am absolutely thrilled to see all the individuals out here in support of liberty. But I have to tell you, Barack Obama was right. That is, he was right about one thing. We do need some reforms of American health care. Unfortunately, he's wrong about practically everything else. One of the major points that he's wrong about is when he says that the problems that we have in healthcare are the result of a failure of the free market. Friends, we do not have a failure of a free market. We have a failure of decades of political interference in medicine. Now, I don't have time to discuss all the ways that politicians have messed around with healthcare in this country, but I do want to quickly review three of the big ones. In the 1940s and 50s, through the tax code policy, the federal government entrenched the expensive, employer-paid, non-portable health insurance regime that most people now get their insurance under. And under this, if you lose your job, you lose your insurance. Now, this doesn't make much sense if you think about it. Why don't we get our house insurance, our car insurance, our life insurance through our employer, but only our health insurance? Well, it goes back to the tax code. And this creates a couple of problems. First, patients aren't as concerned about healthcare costs, and doctors aren't as much answering directly to patients. Instead, they're answering more to politically controlled insurance agents. A second big reform took place in the 1960s with the massive federal welfare programs of Medicaid and Medicare. In fact, the Denver Post reports just today that Colorado's Medicaid rolls have grown to nearly 500,000 people. Now, what happens when you put such a large percentage of the population on the government dole is that, again, patients aren't as responsive to price, and doctors are now answering to bureaucrats instead of to patients. So, yes, we have the greatest health system, the greatest health care available in the world, but we are having some problems with cost and with this disconnect between patients and doctors. In fact, these reforms, because of these reforms largely, on the whole, patients are paying only about 10 cents of every dollar for health care. The rest is paid for by government and through employer-paid or other insurance. Now, when you have government spending nearly half of all health care dollars, that's not a free market. That's not a failure of the free market in terms of what the problems that we're seeing. That's a problem of political interference in medicine. A third sort of control are simply controls that politicians at the federal and state level have placed on what we call private insurance. They mandate the benefits that insurance companies must offer and that we must buy as consumers, and they force insurance companies to cover certain people under certain conditions. So what happens is that this drives up insurance premiums, pricing a lot of people out of the market. If we want people to be able to afford health insurance, then let's roll back all the political controls that have jacked up the price of health insurance. Unfortunately, Barack Obama is not offering us real reform. Barack Obama says he wants hope and change, but he's just offering us more and worse of the same political interferences that have created the problems that we now have, except they would be massively ramped up. What we would have is completely doing away with patients' incentives to oversee costs and to ask the tough questions of doctors. And what that's going to do is drive the political case for rationing. Make no mistake, there will be health rationing if Obamacare goes through. And that would be a disaster for our health. What we need instead of more political interference in medicine is to restore free markets in medicine. Individuals need the right. Patients, doctors, and insurers have the right, and they should have the freedom to interact voluntarily to mutual benefit without political interference. People have the right to make their own healthcare decisions for themselves in cooperation with their doctors, without big government telling them how to live their lives and what to do. In short, what we need is to return to freedom and individual rights in medicine. Thank you.